is this? This is live YouTube with Auburn Medical Group channel. Dr. Mark Vaughan talking to all of my friends all over not only the United States, but getting this time of day, probably one, maximum two in the UK, and maybe a little handful in New Zealand and Australia and maybe other places on the other side of the Pacific. My computer or my phone tells me I have a bad connection. You guys can tell me what it's like on your end. Go ahead and use it. In fact, let me make sure comments are open for all of you, and super chat, of course, always open. So you guys can go ahead and write in, tell me where you're from. And okay, here we go. Big Boy Games is already here at 9:06 p.m. You're the first. Thanks for coming on. I'm glad to have you be a part of it. I don't recognize your handle, so welcome. This is probably your first time here. And Jamie1178, I think I've seen you before, but I'm not totally sure. Anthony, USMC, hey, hey. And Big Boy Games is from Virginia, so you guys are staying up late over there on the East Coast. We'll probably have a number of people from the Midwest and the West Coast of the United States. You guys may have seen the title for the show was Blockbuster Week, and that's because we have really popular subjects in our YouTube videos coming out Tuesday and Friday this week. McNuggets Lover, hello. I didn't know you're from Ontario. You probably told me before, but I forgot. And then Anthony, you're from North Carolina, where there are many people in the USMC around the Paris Island area, Jacksonville area. Omar, you're here. I'm doing very well. Thanks for asking. And then Jamie's in South Carolina. Omar from New York. I think I knew that. And Big Boy Games, in trouble. You're supposed to be asleep. Yeah, I don't want to be getting you in trouble. Maybe I should be on earlier for that. Humboldt Roots is in Humboldt County, not too far away. Same time zone. Hello. Yes, hello, Roots. Humboldt Roots. Crystal, yay, live feeds. I'm glad you love the live feeds. And anybody else coming on, you are also welcome. So I was talking a little bit about the title, the Blockbuster Week. Ann Kapsky, thank you. And you are, okay, so Western Australia. So that's on the far side of Australia from us, so it's kind of early for you in the, no, it's early today, yesterday, tomorrow for you. And Connecticut also, thank you for joining us. Tacoma. Yes, I got very confused last time I was trying to figure out what time it was in Australia because it's the next day, but it's earlier in the day. And Butterfly Girl, hey, always good to have you be a part of our live YouTubes. So we have a good group here, and actually 2 people gave it thumbs up. So 2 of you like it. That's really cool. What I'm excited about to tell you is what's coming up tomorrow. Tomorrow is the first of the videos for this week. And Deborah, hi. It's an earwax irrigation. And in contrast to the one last week where we were digging with the curette, trying to get that out, and it just kept coming, this one's really quick. Ann Kapsky, 28/3 lunchtime, and Sharon, hi, Sharon Calvert. So yeah, I was saying that the one last week, there's a lot of digging with the curette, trying to get that wax out that just kept coming. Well, this one, it's the irrigation with the water pick type device, and less than 1 full reservoir of it, less than 200 cc's of water and hydrogen peroxide, and it's cleared on both sides. Separate reservoirs for both sides. So from Melbourne, okay, it's 3 p.m. there, the afternoon of the 25th, and Omar said something there. Yes, 20, because it's 24th here, so it's the 25th in Australia. 27th? It's the 27th here? Okay, 28th for you. Oh, that's right. I'm stuck on Ethan's birthday. That's why I'm thinking that. Okay, think I'm weird. I'll get excited for videos of all that sort. Hey, you have friends who also think it's interesting and have an interest in medical things. Free to be now 19. Hey, good to have you be a part of our live YouTube. And Coconut Head, I have not seen you in a couple live feeds, so probably the most interesting channels. And oh, I'm glad you think so. I guess that's why you're here. Wife's late grandmother was CEO of Chappaday. Oh, my goodness. Wow. Yeah, we've had people go back and forth between Chappaday and our office. Lady Weasel, hello. From next to a sick, oh, you're so good to be taken care. So, yes, a lot of people who watch this are taking care of sick loved ones or have issues themselves. I find that out from the comments when we actually talk about specific issues, and the people just fill up the comments with their experiences and share with us what they found comfort from and what's helped them, and it's been a wonderful exchange. People can learn from each other on the comments on our videos. So tomorrow's is the quick irrigation. That's tomorrow at 4 o'clock Pacific time. And then on Friday is a good size dilated pore of Weiner. Very satisfying. Big piece and big hard piece. You guys are going to love it. So I'm looking forward to see how much you guys like it, and all those people that like the videos that we put out that go viral. This is expected to be one of them. Anthony, you've got bad lag and voice skip coming on. I think it's on your end because I had a bad connection earlier, and it tells me there's a little bar across the top that says bad connection was bad, but it says it's good now. Oh, and Lady Weasel's excited about the Pore of Weiner. Dr. Gawain says something about sick doctors. I think that's because we both have a cold. Is that what you're referring to? Butterfly Girl has a dumb question. And actually there is such a thing as dumb questions. You can ask a dumb question, even though we encourage people to ask questions and try to not make them feel dumb, but there are actually dumb questions. Deborah Marola, can't wait. Belmont 3166, that's just you sad. Crystal, ooh, I'm ready. Yes, Crystal, it's coming. So tomorrow's is the irrigation. Fridays is the dilated pore of Weiner. Dr. Gawain hasn't even seen this yet, even though I'm always editing behind his back. Well, it's because he was out last week. That's why he missed it. And you guys can ask questions of Dr. Gawain. Maybe he'll answer. We'll see. Omar, sorry, Doc, not sure if you've answered this before, but if you didn't go into family medicine, what would your backup specialty be? Actually, it's the other way around. I went into emergency medicine, and I practiced that for 2 years after residency and getting board certified, then went into family medicine. Dr. Gawain may have a different answer for you. Anthony, USMC, you refresh and it's all better. Thank you. Hey, that's a good little bit of information for other people who might have bad lag or voice skipping. Try to refresh it, see if it works any better, because you should have the link somewhere, the original link that you followed to get here. Should be able to find it. And Omar, okay, yes, it is. And if anybody wants to make absolutely sure that your comment gets read, when you write the comment, you hit that little $ thing and use the super chat. But we don't need it now because we don't have too many people commenting. Dr. Gawain says surgery. He likes doing procedures too. He likes working with his hands. Butterfly Girl, my boyfriend has a shunt in his head. What do they actually do besides filtering the fluid on the brain? If it's what I think it is, a VP shunt, ventriculoperitoneal shunt, where it comes out, comes down behind the ear, down the neck, and into the peritoneal cavity, it's not filtering anything. It's a way for the fluid that's produced by the brain to be removed so that you don't get increased pressure inside of the skull cavity. Lady Weasel says, YouTube has been lagging on live feeds today. Sorry, I had to abandon April the giraffe because, oh, how is April doing? I haven't watched that lately. I guess she hasn't had the baby yet, if people are still watching. Or maybe April's the name of the baby. I'm showing my ignorance here on giraffes on YouTube. Do you know about April, the giraffe on YouTube? You're the one who told me about it.
I don't watch YouTube.
You don't watch YouTube. Okay, we actually have a pure one here, unadulterated by the evils of YouTube, which actually is not bad as some of the other parts, or at least this part of YouTube is not as bad as some of the other parts of the internet. We have a relatively nice environment here, thanks to you guys for making it a nice place to be. Butterfly Girl, that's also known as hydrocephalus. Correct. Yes. Not hydropotamus, but hydrocephalus. Lady Weasel, anywho. Yes, hydrocephalus, hydro meaning water, cephalus referring to the cephalus or the head, and water on the brain is another way it's called, where they have too much production of fluid, or the fluid isn't draining because there's a blockage on the drainage, or the way the body normally absorbs it. Omar B says, thinking about volunteering in a nearby hospital soon, looking forward to the opportunity. That's a great way to learn more about medicine and to get experience that you can put on your applications or resumes as you climb the ladder to whatever level of medicine or nursing or therapy you want to ultimately achieve. So good, volunteering at a local hospital is an excellent way to start. And if you have any problems about it, let me know. I might have suggestions for other things to do, because I don't know why I said that. I guess it's because of experiences people I know have had volunteering. Some are great and wonderful, others are not as great and wonderful. So I hope that yours is one of the great and wonderful type. Going back on the comments that you guys have been putting here, Dr. Gawain said surgery. I'd be curious to know if Dr. Gawain actually applied to any surgery residencies, because I don't remember you talking about applying to any. Of course, I just know the ones you actually interviewed at, which were family medicine. Now, Sherry Vinson, first time is catching me live. Thank you, Sherry. I'm glad that you caught us. And I'm sorry that I make it so much of a challenge, but I like to make things kind of like a game where you have to try to catch me live. Uh, Somebody's laughing at me because I'm making excuses for not being regular on my schedule. Because what? All right, Humboldt Roots. Well, my recent medical story, I was playing basketball on Saturday at Open Gym and totally sprained my MCL. Had a nice ER visit. It popped and hurt so bad. Feels much better now, 2 days. Isn't it amazing how much those ligaments can repair if you don't actually rupture them, if it's just a tear? Sometimes they can heal very nicely and don't need to get MRI and surgery and orthopedics consult. And that's one of the things we do in primary care is give you that little bit of break, evaluate it, see if it's something that needs to go right on right away, or if it's one of those things that can do some physical therapy, give it a little time. You may not need to do all that stuff with those over the next 4 weeks or so. And Lady Weasel's mom recently diagnosed with primary lymphedema. How would doctors not catch it until her 70s? She may not have had it until then. TC in Canada. Love the channel and think you have some of the nicest clients, and you seem, I guess you're referring to the patients. Such a great caring doctor. Hi from Elizabethton, Tennessee. Hi, Elizabethton, Tennessee. Later out there. Now, Dr. Gwain did answer here. He didn't actually apply to any surgery residencies. Working outpatient was more important to him. And my wife, working outpatient? I mean, like not being in the hospital. Okay, that makes sense because hospital life is different from outpatient. From outpatient. Outpatient, you can have hours. You have to be on call on the phone, but beyond that, you don't have to actually drive in and take care of something in primary care if you have somebody else covering the hospital, like a hospitalist team like we have in our local hospital. So Dr. Gwain and I don't actually have to drive in after hours. We just answer questions on the phone, and actually even that is not that much, because if it's something that needs to be evaluated and seen, well, it's not going to be us, so people just go ahead and go to the urgent care or the emergency department on the after hours, whereas if it's during hours that we're open, they come in and we take care of it. So we get a very nice lifestyle out of it. Not as convenient for patients as if it was us who would actually drive into the office and open it up, but it's a lifestyle choice on our parts to do it that way. Hey, Pamela, good to see you this evening. Thank you for coming. All right, backing up to see. Oh yes, TC in Canada, thank you for the compliment. I appreciate that. Primary lymphedema, yes, it's something that does not always develop until later, so it may not have been there. You have to see it to be able to diagnose it. Also, this primary lymphedema, they may have been ruling out other causes before it got actually diagnosed as primary lymphedema, so it's not something that on first visit you necessarily get diagnosed. Do I have a Periscope? Yes, I do, but I do this instead. I deleted it because I forgot my Twitter account. That's fine. That's fine, Butterfly Girl, because I only am doing the live YouTube now. I'm not doing Periscope anymore. I like to keep it all in one place. So that's why I was very much waiting for YouTube Live to come along. That entire time that I had fallen off of doing the Periscopes regularly, I was waiting for this. Crystal, have a few issues, fibromyalgia, inflammatory polyarthritis, and my doctors put me on so many meds, as often happens with those problems, because people hurt without them, and it's very hard for people to get to a place where they don't need medicines. Fibromyalgia, hard to put that together with inflammatory polyarthritis. That's kind of a double whammy there. Both muscular tissues and joints are hurting. At least with fibromyalgia, you can get to a place where you're exercising enough that the pain is controlled. The problem is to get to that place where you are able to exercise enough, because it hurts to move and it hurts to start. And so people with fibromyalgia are very limited in what they can do other than medicines. And then the awful thing is these people are often put on opiate pain medicines that don't actually help make the pain go away. They just make you not care about it, except when you don't have the opiates, then you really care because you want them, and you're still having the pain. It's not eliminating the pain. So that's why we're really trying to not use opiates for fibromyalgia, but rather use medicines like Neurontin and gabapentin and Lyrica. Lyrica. Neurontin is gabapentin, Lyrica is pregabalin, and also Cymbalta helps with it, and trying to avoid the tramadol. Just had a whole lot of comments there, and that's okay. If you need to break through, you can always use the little $ for the, what's it called, super chat, but I'll try to catch up. So Jenny Mueller says, And you're regular, I recognize you. I've got a torn meniscus since February 26th. Also have a hematoma in the knee from an injury. My question is, how is a hematoma different from a bruise? Hematoma is an actual collection of blood, whereas a bruise is just kind of a discoloration from blood that bled through to the skin. But the hematoma, there's a clot there that's intact and taking up room between layers of tissue, meaning that maybe you could actually cut it open and pull it out. A bruise is just all over in the skin. You don't necessarily want to remove it, though. Pamela, 2-day scoliosis surgery was scheduled today for May 19 and 26. Oh, my goodness. I hope that goes well for you, Pamela. Dave F. Hi, doctor. What's your views on trigger point injections for migraines? Just went to a conference at USC last week, or the weekend before last, learning how to do that myself. Not trigger points, though, but actual nerve blocks of the greater occipital and lesser occipital nerves, and on those rare people who have one, a dorsal occipital nerve. Hey, Dr. Gwayne, did you know about the dorsal occipital nerve? Maybe you did and you forgot. Butterfly Girl, gotcha. Okay, cool. Omar, have you ever considered coming out with Auburn Medical Group merch? Like t-shirts or something. I don't know. Although, I guess it would be awesome though. You know what? We would like for our viewers to come up with designs for that and actually partner with them so that they can also benefit from if people want to purchase such a thing. Or if you come up with really good design using our logo, go ahead and make it and take pictures of it and show it to us. And you know, if it's really good, maybe we'll work together and make something that benefits both of us. But we haven't done it ourselves. We just tried a little bit with the Dr. Terry Bull, which I think somebody who actually has one of those sweatshirts is on here. I'm looking. No, I'm not seeing. Anyway, Antoine has one. BooBoo Kitty, welcome. Good to see you. It's more fun than Periscope. The hearts were fun on Periscope, though. I guess here you can do the likes. Oh, and the super chat. That's more fun than the hearts on Periscope, but we don't get as much of that. And BooBoo likes that idea. Omar and BooBoo, you guys are going to have to come up with some shirts for us. My mom's got fibromyalgia. It sucks. It's awful. Lady Weasel, ugh, opioids. Dr. Gwayne, Auburn Medical Group, running attire. That is something we've actually talked about. Getting some really cool running shirts made out of that material that's supposed to be sport material. Dr. Gwayne can tell me what it is. And I'm imagining something that's like white, short sleeve, fits kind of snug, tight, is elastic, and has Auburn Medical Group logo across the front. And on the back has Dr. Gwayne's picture, real big, a portrait of him. That's my thought. Okay, catching up with you guys. Dave F., what's your view, doctor, on a medical weed for migraines versus trigger point injections? Not trigger point injections for migraines so much as nerve blocks. That is more effective, hitting the lesser occipital and greater occipital and sometimes the dorsal occipital nerves. Weed for migraine, if it helps, yeah. If somebody's just using an excuse to get high, no. TC in Canada, I have fibro, and yes, it does suck. BooBoo Kitty, more like lounge clothes, Dr. Gwayne. Oh, we have two different camps here on the type of attire that has Auburn Medical Group logo. Dr. Gwayne may not approve of it being on the lounge clothes. We'll have to find out on that. Excuse me, Crystal M. Yes, I'm on tramadol. I think it's supposed to be Robaxin, Celebrex, methotrexate, and Lyrica. Wow. Wow. That is a lot for your body to process. Sorry, Butterfly Girl. Jenny Mueller, thanks so much. Love your live chat. And Jenny, we love you participating in it. That's what makes it. You guys participating. Butterfly Girl, thank you, Crystal. Anthony, USMC. Get Botox for my migraine? Yes. And I have 4 treatments every 3 months. It has really made a miracle. Only 2 migraine headaches in 6 months. Actually, at the talk I went to, you had to choose either the nerve block or the Botox injection lab. And I went with the nerve blocks because we already have everything for that. We wouldn't have to order any Botox to do it. But yes, both have been found to be effective. And Crystal, sorry for TC in Canada. BooBoo Kitty, never ordered the apparel because I didn't want Dr. Bull showing up here. Isn't that funny? The only person that ordered something, Dr. Bull, actually showed up in their town. For those of you who don't know, we're talking about Dr. Terry Bull. That's B-U-H-L. That's another channel that I have nothing to do with. Bev Campbell, I have peripheral neuropathy. How is fibro different from peripheral neuropathy? My left foot and leg goes numb with what feels like shocking needles in my left foot. So what you're describing is a neuropathy. Fibromyalgia is a pain that's in the soft tissues typically these people will be tender at certain points. You can push on their body and it'll elicit tenderness. A little confusing though, because when you do this enough, you start to wonder, well, wait a minute, do I have to push in those spots to make these people hurt? And you'll push in other places, and some of them hurt, but others actually do follow the points that, if you look online on Google and look up fibromyalgia points, it'll show you these places to push around the joints. I don't say on the joints, I say around the joints. All right, let's get back here. Dr. Gwaine says, picture on the back so you can see it, because I run faster. Oh, have any of you guys seen? Okay, I don't know if I'm reconnected or not, but I'm going to go back up on these. Sleep would be cool. I'll be sure to come up with some shirt ideas. Got it. Okay, Omar, we'll get back together on the shirt thing. BooBoo Kitty, a swimsuit, Dr. Gwaine, on one breast, Dr. Vaughan on the other breast, and Dr. Bull elsewhere. Oh my goodness. BooBoo Kitty. Bev, pain meds is Lyrica, 100 milligrams a day, and that's not a bad dose of Lyrica. That's actually kind of a low dose of Lyrica for daily dose. Butterfly Girl, what would be better alternative to treat hives besides prednisone? Well, yeah. If you can get by without prednisone, that'd be great. If, just simply Benadryl or hydroxyzine and maybe some topical steroid cream, low potency steroid cream, that'd be really good. Sharon Calvert, my poodle knows every fibro point I have, because wherever the poodle jumps, it hurts. Crystal M, I froze. Yeah, I did too for a second there. Pamela, lost the connection. I think it was on my end. Sorry, guys, that was me. Oh, I lost feed. Yes, but I'm back. Sean Gupta, is there any relationship between fibromyalgia and depression? And a lot of people there is, absolutely. And in fact, this is that whole pain, depression, connection, which comes first, because some people can actually feel physical pain when they're depressed. Other people get depressed when they have pain. And we have these antidepressants that work on both, like Cymbalta, the SNRI type medicines, because the pain pathways and what happens in depression on the level of neural pathways, there's a lot of overlap. Again, if you guys want to use Super Chat to break through and get my attention and everybody else's attention, you are welcome to. BooBoo, I like your question, Sean. I wonder that too. Back. Crystal M. Sean, I'm not sure, but it did for me. Kevin Obanoff, I think I've seen you on here before. How are you supposed to clean your ears if you're not supposed to use Q-tips? By irrigation or ear softener, over-the-counter ear softener. Got to go. Okay, TC, we'll catch you next time. Thank you. Thank you for being here. Dave F. Why do some emergency migraine meds cause tightness in the chest? Oh, that has to do with something else we talked about at the conference. The medicines for aborting a migraine, I say aborting because if you already are in the main part of the migraine, the pain, sometimes they will not work. You have to do it in the early parts, like right after you have the aura. And these medicines work on 5-HT or serotonin receptors. I think it was number 1. Well, you also have those in the blood vessels to the heart, and so you get some constriction of those vessels, which actually can, in the right person, cause a heart attack. Somebody who has some heart disease, you start to close off that vessel, you could actually close it enough to block it off. So that's why you can't use them in cardiac patients. Now, the newer drugs that they're going to be coming out with, some may actually get approved this year. Maybe they're actually better, at least in their studies. They try to make it sound like they are. And the guy that spoke at this conference actually was a consultant for the companies that make these drugs. So, know that there is some influence there on the money side. But he was talking about these medicines that work just as well in the cerebral vasculature, but don't have receptors on the blood vessels in the heart, so that you'd be able to have these drugs like sumatriptan, the triptan type drugs, without getting the heart artery constriction, just for the arteries in the brain. So that's something we'll look to, and we'll see if it actually does make a difference clinically. The studies are going on. Crystal says anxiety too is another thing that pops up with fibromyalgia. Yes, it does. Kim Dreamin, problem with my left knee, having shot in the knee tomorrow. I hope it goes great. Watch our videos on knee injections. You'll see that actually usually they go very nicely, and a lot of patients don't even respond like there's any pain at all. When we freeze the knee first and then do the shot real smoothly, it goes really well. BooBoo can tell you, she's seen some of them. BooBoo says Dave is a constriction of the blood vessels. Dave F. Oh, okay, interesting and scary. Kim Demon, problem my left knee tomorrow. Having a shot in the knee tomorrow. Will it hurt? Part of it might, but it shouldn't be too bad. Watch our videos. You'll see how we do them. Dave F. Glad I don't have any heart conditions. BooBoo Kitty. Dave had that one. I had an epi injection. Yeah, it'll do it too. Epinephrine very much is a vasoconstrictor. Dave F. Okay, BooBoo Kitty. Sean Gupta. Do you think that working as an EMTB, a basic EMT, during undergrad pre-med would help with getting into medical school? It might. At least what you'll have going for you is you'll be able to show some real experience in the medical field so that you can tell whoever's interviewing you at your medical school interviews that you do indeed like the medical field. You can show that you've got a capacity to learn from those type experiences. You can get experiences that will be things to talk about during the interview, like cases you've had or patients you worked with. That is always something that's going to come up when you have the experience and be a very good plus for you in getting the attention of the interviewer. Just to have something to talk about puts you ahead of all the people who have no experience. So yes, I think that's a very good thing. In fact, I'm encouraging my own daughter, who's a freshman in college right now, applying to PA school, to get EMT-B or some other type of medical assistance certification so that she can get hours in, which is actually required for physician assistant school, even though a lot of medical schools don't require that kind of experience. Dave F. says, I take MCAT exams for fun. I enjoy the medical field as part of my Asperger's. That's an interesting thing. Kim Demon, what do you know about CBD? CBD? Cannabinoid disease? Cannabinoid disorder? Chronic botulinum disorder? Cannot buy drugs? CBD. Cannabinoids? Anybody's welcome to give me other interpretations of what CBD is. Oils? And Crystal just thinks it's funny. Okay, well, at this point, what we'll do is go ahead and wrap up. Hey, guys, yes. And Jenny Mueller, cannabinoid oil. The cannabis. Thank you, Kim. Hey, Lady Woozle, the ER gave me a drug for a headache. I got really angry for no rational reason, because who gets angry at the people helping you? They told me I was allergic reaction. Can't remember which one. I think what you experienced may have been akathisia, and it may have been compazine that you were given, prochlorperazine. And this akathisia is a sensation of not being able to hold still, and it's extremely unpleasant, and there's no way to just get rid of it, but you move around and you just got to move. And oftentimes these people will just bolt from an emergency department before you get a chance to give them the antidote. If you give the compazine a certain way in the first place, you can avoid that. So it works better if it's given IV, but if you give it IV, you have a higher incidence of akathisia. Well, Dave Vinson, who last I knew was working at the emergency department in Kaiser at Roseville, when he was in residency, did a paper on, or was participated in one, I think it was his project, where they found how you could give the compazine and have a very low incidence of akathisia. Two things. One, give it with Benadryl, which is the antidote for akathisia, and give it slowly, like in a bag of saline, maybe 500 milliliters or 250 milliliters, or just 100 milliliters, and give it over some time, 20 minutes, 30 minutes. You'll get rid of the migraine. You won't get the akathisia. Patients will do great. So you may be able to have compazine if it's given in that manner rather than just whoop, give it all to you at once. Dave, I found Toradol to be an amazing drug for migraines. Yes, it is. That stuff burns, though, going in via injection in the arm. And that can be given IM or IV. We give different doses depending on which one it was. And, yeah, as far as the marijuana, what I really want with marijuana is some research. Let's make it Schedule 2 instead of Schedule 1 so we can actually get some information on it instead of all of these somewhat honky studies that suggest, maybe it's good for that, maybe it doesn't cause cancer, maybe it's not bad to smoke it. Let's find out. Let's make it Class 2. Let's do studies and have some real good data with some real good numbers instead of all this weak stuff that's out there. It was IM. Okay. Oh, that's Dave saying that he had it IM. And you can also get it IV at a lower dose, give 30 milligrams IV. Anthony at USMC, I think you're talking about my idea of let's make marijuana Schedule 2 so we can get some good research on it, find out what it is useful for. You know, whenever something makes somebody feel really good and euphoric, there's going to be people who are very suspicious of the use of it. That's just the nature of it, so deal with it. Legal in all, CBD is legal in all 50 states. Well, it's not, if it's cannabis, then it's not FDA approved for anything. So what you're talking about is probably some kind of related medicinal, I shouldn't say medicinal, what's the word I'm looking for? Botanical, not regulated at all. So I really can't tell you much on it because I don't have a lot to go by. These things that aren't FDA approved, people will go crazy over it, and it'll work for all sorts of things because you get a placebo effect of 15 to 30% no matter what you do. But that doesn't mean it necessarily would do any better than a placebo. So that's why we don't go giving them to everybody. All right, let's find out where we are here. I agree with the chronic pain and cancer patients, etc. with class 2. When will they come out with something good for chronic pain that's not addicting but as strong as an opiate? Okay, Pamela, maybe we need to talk a little bit more about chronic pain. It doesn't make you high, I believe. Lady Weasel, there are so many strains of marijuana, it's probably difficult to control the studies because of it. It's cannabinol that doesn't get you high. We do have some cannabinol, yeah, like we have Marinol. Marinol is an antiemetic that's given in a pill form to help with appetite, although I've not really had success with it in patients that we've used it for, cancer patients or patients who are in senescence, meaning their body is in the process of dying. Okay, so we will have you guys. See you next time. We're going to have a great video at 4 o'clock tomorrow for the irrigation, and then Friday is the dilated pore of Weiner. I look forward to you guys seeing that and seeing your comments there. Till next time, Dr. Mark Vaughan telling all of you to stay in good health.